Travis Pantiel joins us from American Addiction Centers to talk about wanting to help people from a young age, the ability to get people to open up quickly, and trauma treatment. He talks about the importance of treatment programs like theirs for professionals and looks to the future of integrated healthcare, where the boundaries between medical care, mental health, and other patient care like chiropractics or yoga can be managed in synergy for the most effective patient solution. Enjoy. Welcome to the Illuminate Recovery podcast. We shed light on mental health issues, mental illness, and addiction recovery, ways to cope, manage, and inspire. Beyond the self-care we will discuss, you may need the help of a licensed professional. My name's Kurt Nider. I'm a husband, father, entrepreneur, a handyman, and a student of life. I avoid conflict, I deflect with humor, and I'm fascinated by the human experience.
And I'm Shelley Mangum. I am a clinical mental health counselor, and my favorite role of all times is grandma. I am a seeker of truth, and I feel like life should be approached with tremendous curiosity.
I ask the dumb questions.
I fill in the gaps.
The Illuminate Recovery podcast is brought to you by Illuminate Billing Advocates. Make billing and collection simple with leader in substance abuse and mental health billing services. Verification and analysis of benefits, pre-authorizations, utilization management, accurate claim submission and management, denial and appeal management, and industry-leading reporting. Improve your practice's cash flow and your ability to help your clients with Illuminate Billing Advocates. Today we've got Travis Pantiel on with us. He's an experienced licensed mental health clinician. He's been in the industry for a little over 10 years. He's been with American Addiction Centers for almost 6, working on a doctorate of behavioral health, and is a licensed mental health counselor. So thanks for coming on today, Travis.
Yeah, absolutely. Appreciate the invite.
Yeah, of course. Excited to hear more about what you're working on, what you're passionate about. Maybe give us a quick little story on, where you came from and how you ended up in the field.
Yeah, absolutely. I don't know if it's a really fancy story, but I was born in New York, moved down to Florida as a teenager, and basically decided I don't like snow, so I'm staying in Florida forever. I found myself very interested in helping people very early on in life. And with that, I found myself getting into the mental health field. And since then, it was kind of a straight shot all the way to right now, where I decided to put myself back through the rigors and go for my doctorate, because either for my ego or just for my interest in helping people, it's something I felt interested in continuing on. And especially with helping make mental health and behavioral health and medical health all one combined phenomenon, so people don't have to go to one place or the other, but actually just finally get themselves involved in all treatment at one time.
Yeah, that's fascinating. So it's interesting that you say early on you got interested in helping people. And this has come up in the podcast before, because a lot of the people that are in, especially the addiction recovery, substance abuse, and treatment industry, get here because they've kind of come through it, right? A lot are in treatment, this is not exactly a field that people grow up wanting to be in, except some people just have this kind of early sense of wanting to help, right? In fact, I think we had one guest just called them helpers, right? He had learned about being a helper. So where did that come from for you? Do you feel like that was instigated by a parent? Where do you feel like that kind of inner drive came from?
It's a good question, and I don't think I knew the answer of that until I started helping others and being more influenced in the field. But, mental health and addiction runs in my family. So it's ACOA, if you're familiar with that, the adult child of alcoholics and those kind of phenomenons. There's a big laundry list, and I'm sure I've got a couple of them. And one of them is being a helper, learning to help where you believe you're needed and being a part of that. And for me, that turned into, being able to talk to people in a way that had them open up pretty quickly. And I think for me, that just gravitated into using that for good. And eventually winding myself up to a field where I'm able to help people on a variety of issues. Specifically right now, it's substance use disorders, and I also expertise in trauma. So I do a lot of trauma work. And when we look at addiction and trauma, they're kind of like peanut butter and jelly, right? Where you find one, you're most likely going to find the other. So being able to work with both, it's just been something that's, I don't want to say come natural, or maybe it just become normalized, one of the two. But it's something I'm able to do, and I'm glad to be able to provide it, honestly.
Yeah. So tell me about the adult child of alcoholics, right? Is this now, are you saying that this is like a symptomatic, what would you even call that? It's not like a diagnosis. Obviously, you're just kind of assigning terminology to kind of where you've come from. But are there a consistent set of symptoms or traits that come from, people who come from that same background? Is that what you're saying?
Oh, absolutely. Adult children of alcoholics or addicts, there's different phrases for it. It's been around a long time. It's an actual group, like kind of like 12-step. There are people, there's meetings, there's all kinds of approaches to it. And basically, it is a representation of traits and features that people start to have for survival mode when they have family members, friends, and not necessarily exactly parents, but it could be uncles, aunts, grandparents, siblings. It can kind of go all different ways. And it's a representation in how people learn different traits to manage. Whether that's handling crises or chaos, or just really strict measures that they had to live by expectation-wise that weren't maybe necessarily normalized that other people would have to experience. It's a powerful way of describing someone's experiences in childhood when they have these other obstacles that maybe other parents didn't necessarily engage in or family members engage in. So yeah, it's definitely used to describe that.
That is super interesting. So you mentioned kind of being a helper as part of that. What are some of the other traits that you see often?
So if we were to look at the laundry list, there is, and it's a pretty, I would say, standard thing you see a lot. If I was to go over the 14 actual traits of a laundry list, it is becoming isolated and afraid of authority, becoming approval seekers and losing identity in their own process, being frightened by angry people and by personal criticism, either becoming someone who struggles with addiction like alcohol, or marrying someone or getting attracted to someone with a very similar concept. Even the personality of that, almost like a workaholic maybe, would be a representation of that. Someone who has that drive and continuous need to do something. And there are quite a few other ones, like overdeveloped sense of responsibilities, which makes us feel like we have to be helpers. But there's the other side of that where we have difficulty making connections with people, confuse love with pitying people or rescuing people, getting addicted to the idea of excitement, judging ourselves harshly, having low self-esteem. And really, it kind of keeps going into it, where it shows a cycle of the disease if we don't do something to either manage it, break away from it, or understand it better so we don't fall victim to it.
That's super fascinating. Is this a community that you're active in? Like, is this something that do you go to groups, that kind of thing? Or is this just something that you've kind of learned over time, and so you've been able to manage some of those?
Yeah, it's not something I'm actively involved in. It's something I teach and demonstrate. And, I've been to 12-step meetings because I feel like you have to attend them to understand them to be able to provide that information. ACOA is something I've been more just aware of and help people kind of just understand a little bit. Oftentimes the people I'm working with who have addiction issues often had parents who had addiction issues, or it runs in the family and maybe you skipped a generation. Sometimes you may find someone who has addiction issues, their parents did not at all. That's because their parents ran away from it because their parents had addiction issues. So it's very interesting. So I think just having this information, it shows where some things may come from and how to be aware of breaking a cycle so your own children don't fall victim to it.
Yeah, I'm sure there's plenty of people who'd be like, oh, I don't want to label that. I don't want to, that kind of thing. But
right.
But to me, I think there's certainly people who can turn that into, kind of a victim type thing, or they're not in control of their life anymore. But I think for most, it's empowering to know, like, okay, there's some of these things that are not intrinsic. They're not me. They're not my fault. These are things that, other people who come from my same background are also struggling with. So to me, I think there's a lot of empowerment to those types of things. Another thing you were saying was that you kind of naturally, well, I don't know if you said naturally, I'm jumping to a conclusion there. You said you get people to open up quickly. Is that a skill that you've cultivated, or is that kind of a talent that you've grown up with?
I guess I never really looked that deep into it, but I guess it's something that I've cultivated over the years. It's a soft skill, right? And it's one of those skills that it's hard to teach someone to be personable, to have those soft skills to engage in someone and make someone feel comfortable. I supervise therapists, and there's the ones that come in that do great at it and the ones that struggle a little bit for various reasons. And it's not to say that they don't have skill sets, but it is a harder one to teach. So I do think there is some natural ability there, and people cultivate it to meet goals for whatever they might be. So yeah, I guess I would say it was cultivated over time with myself and working at it, but something somewhere had to give for me to be able to do it in the first place, I think.
It sounds like it came natural to a certain extent.
You said it.
My mother had this skill. This is a side note. And I think because of that, she was not a therapist, but turned out playing therapist for a lot of different people. Right. And even at her funeral, this was kind of like one of the big compliments that people gave her, right? Like, she could see through them, right? They felt like they could be open, and they felt like she understood. And you call it a soft skill, but I've kind of always wondered if that's something that, it sounds to me like it comes more naturally to you, but I would be interested if that's something that you can kind of cultivate. And I would assume that as therapists, as an industry, you kind of have to learn how to do that on some level. So
I think
anyways,
as an industry goes, we in school learn how to use these skills in a specific way, right? We learn how to use certain words, certain directions, certain ways of opening up a conversation through, different styles. But, like you mentioned with your mom, there are a lot of people out there that have that empathic ability to feel and see through things and connect. And you don't have to be a therapist to do those things. It just can come naturally to people. But at the same time, going through the professional rigors and learning how to recognize the real symptoms and warning signs and how to provide long-term care, that's where you take those natural skills and put it to like the professional standards of making sure people are well.
Yeah, that's a multiplication, right? Anybody just likes to be heard. That's the soft skill. But doesn't mean that you can provide care for them necessarily. Well, that's super fascinating. So working on the doctorate now, what does the day-to-day look like for you at American? What's your role there? What are you excited about on the way to work?
So I've been at American Addiction Centers at our River Oaks facility in Tampa, Florida for quite a while, since we opened actually in 2015. And I've had a chance to kind of go through a variety of different roles and do a variety of different things as we've grown as a program. And one of my favorite things we're doing right now is we are currently providing care and support for the people that provide care and support. Since COVID, we have seen a tremendous amount of people in the healthcare industry struggling. Right? Everyone's been struggling with this. It's pandemic, it's clear, it's been difficult for just about everyone you can imagine. But healthcare professionals have been on the front line. And it's not even necessarily just the frontline people, as you imagine, like ER doctors and nurses, but even past that, therapists have been on the front line, and they have been absolutely inundated with more clients. It has been one of the busiest years to date for almost everyone I talk to, whether in private practice or a program like mine, or doing something completely different. Everyone's seeking help, which is great, but at the same time, overwhelming. So what we started to really notice is that for physicians, for nurses, for behavioral health professionals, or just really in the allied medical programs. They're experiencing a lot of stress, a lot of burnout, and a lot of substance use to help manage that burnout. So we provided a professionals program really designed to help target people in that healthcare industry, but also other people who may have professional programming like licensures and certifications to keep practicing, and help them return back to their employment, their profession in a safe, sober way with some safe strategies so they can continue helping people without harming themselves to do it. And that is a really important place to be, especially as we work forward here and have so much more, like a spotlight shed on this topic.
Yeah, stressful year and different stress, right?
Mm-hmm.
Nobody was programmed for this. The
No.
providers with experience over the last 30 years, they're not ready. Guys fresh out of college, they didn't teach anything about it there either, right? So this is not necessarily for the professionals in your program. These are for industry professionals across the kind of medical profession. And maybe that's an assumption. Are these outside of medical too?
So we can go outside of medical. I mean, the program was initially thought of for specifically primary care physicians because they are the most overworked and overloaded of all the medical categories. And they oftentimes are the ones seeing mental health clients more than mental health clinicians are because of just the nature of primary care, unfortunately. So there's a huge burnout. Up to 40% of physicians are burned out. There are articles that I was reading not too long ago saying doctors are just quitting medicine, not with any backup jobs or anything else, just quitting medicine because they can't handle it anymore. There's too much loss, too much medical bureaucracy, too much barriers along the way for everyone, and they just said, I've had enough. And unfortunately, that doesn't get better unless we provide better care and support. And that's the goal of this program, to really make sure that support gets provided, especially for those struggling with substances on top of it, which a lot of people turn to alcohol, turn to other substances to manage stress, right? And healthcare professionals can be no different at times. Same thing for attorneys and nurses. Attorneys have some of the most high-level substance use that there is. Almost 30% of them struggle with depression and substance use because of it.
Yeah, those are both stressful jobs, and substance abuse has some different connotations, right? Because I think there's the illegal drugs, but there are many mind-altering substances that are perfectly legal. There's nothing
Absolutely.
wrong with a doctor who has a drink from time to time, but like you say, that turns that into addiction pretty quick, or any other form of abuse, I guess. But so what does that program look like for you? Is that a residential program? Is it an outpatient program? I assume if it's a kind of designed for working professionals, there's a schedule flexibility there. How does that program work on a day-to-day basis?
So the program that I'm in is actually a full scale treatment. It starts off with medical detox, residential levels of care, outpatient programming like partial hospitalization and intensive outpatient. So we do have all the levels of care that one would hope for. In the world of COVID right now, though, with visitation being minimal and it's difficult to have outpatient services that are true, we've been having the majority of our clients enter in detox and really stay on campus with us while they finish their treatment out. And that's really been great for consistency, to ensure that everything is going right in the directions they need. And then by the time they leave here, they have an aftercare plan that oftentimes includes going back to work and maintaining safety. In fact, in Florida, there are a couple of programs that are responsible for this for physicians and mental health professionals called the Professional Resource Network, PRN. And basically, they step up when anyone's license is in jeopardy due to mental health or substance use. And they will help that person get into treatment, get themselves in a safe place, and get them back into a better place. And treatment combined with aftercare has got a very high level of success. And usually with the PRN program, we're talking numbers of over 80% success rate, which is pretty phenomenal.
That is phenomenal. You mentioned the PRN and you mentioned having licenses in jeopardy. What are the circumstances where that license is in jeopardy? Meaning if somebody doesn't ever do anything wrong in the workplace and they recuse themselves from work, come get treatment and go back. Does that ever, are there lines or flags that are, kind of crossed there that put somebody in jeopardy, or do they have to do something wrong in the workplace? What are the circumstances where that licensure is kind of under investigation?
So historically, people who struggle with substances or mental health would, take a leave from work, get treatment, go back. No one's really none the wiser for the most part, and continue on until something happens again. For programs like PRN, and we also have for nurses called IPN, which is the Intervention Project for Nurses. Basically, something has to happen in the workplace, or something has to happen in a legal way, such as like a DUI or some type of arrest or a charge that's related to substance that needs to be identified and managed, right?
Mm-hmm.
So for medical professionals, a really common thing we might notice is for nurses who are struggling, diversion of medication. Taking medication from a patient and taking it for themselves is unfortunately something that we see a lot. And when that happens, it's a huge thing. And hospitals want to make sure that everyone is treated well and safe, but they also want to make sure their staff are safe. So everyone's license is, including mine as a mental health professional, all of our licenses state that if we do anything that is illegal that involves substances or mental health, that there's a chance that we can lose our license due to risk of providing care in the future, right? If your doctor is struggling with a opiate problem, there's a good chance that we may not want them continuing care while they're actively on substances, right? So the Board of Health, the person's board, would then see them, and then PRN would step in and say, hey, we'll help this person before they lose their license by giving them a chance to get better, because hopefully everyone nowadays is recognizing that addiction is a disease and there's mental health components to it, and people can get better 100%, but we just have to give them time and the right path, which is why a program like this is meant to help make that a possibility.
Yeah, that's great. I'm sure it's been more than helpful over the last year. I've seen a lot of those numbers go crazy.
Yeah,
so
absolutely.
what does the future look like for you? What's the track on your doctorate, and where do you go from there personally in your career?
So the doctorate was actually started based on my interest and confusion. Once you get into the field of mental health and just the medical field in general, you see that there's a massive divide between the two, right? You get medical care, you go to your primary care doctor, and then to get mental health care, you have to go see a completely different program, a therapist, someone outside of that. The problem is for the general public, seeing your primary care doctor is normalized, but seeing your therapist isn't as much, right? And I think that stigma's kind of slowing down. It's getting better, but it's still pretty significant. As I mentioned before, primary care physicians, the primary care environment, the way the whole setup is made, basically sets up primary care for failure, because more than 50% of mental health patients go to primary care first before they see a mental health program, because it is kind of the funnel system. We funnel everyone to primary care or the emergency room, and then they're supposed to get diverted to something else. But most of the time, people don't follow up. They just go back to primary care for the next crisis or emergency, which historically has not been very effective, as we see mental health becoming a massive thing in our country. So this doctorate that I'm working on is through Arizona State University. Great program so far. And what they're really doing is trying to promote this idea of having an integrated healthcare system where you put everything together and it's a one-stop shop where everything becomes normalized. You see your doctor and the doctor says, hey, talk to this therapist for a minute about whatever's going on, whether it's a major mental health crisis like depression, or they just need to lose a little weight and need some motivation strategies. Or maybe they just lost someone and they need a little grief work. It's meant to kind of tackle a little bit of everything like a primary care physician does, and give that person some backup, because primary care physicians don't get training in mental health. That they're kind of just trying to make it work. And unfortunately, that's not going to be the system that helps get our generation and our country in a safe mental health world.
And I think some of the insurance changes over the last, 10, 15 years help with that too, right? Meaning I can screw all of the different acts up, but affordable care and requiring, some of the mental health and behavioral health insurance coverages make that a little bit bigger for an integrated health provider to combine those, right? Because it's going to be impossible for a behavioral health specialist to ever include the rest of the primary care, and that direction of health versus you kind of got to be a little bit bigger organization, or at least not necessarily in size, but I think it takes a different, either, small practice or a little bit larger, mid to large size facility to be able to cover both of those. And so it seems like that would help open doors for that a little bit.
Yeah, it's scale. That scale does matter. And for primary care, including behavioral health is another spoke in the wheel because they include all kinds of different treatment options. But mental health has been historically put to the side as a specialty. If you think of all the different types of holistic care, chiropractic, think of like yoga, those holistic exercises, massage, all those things are considered medical. And they oftentimes have programs where all that stuff's included, but mental health is slowly getting brought into it. And they're seeing lots and lots of data now that says when you include all of these things together in an integrated program in one place, you get much better results with less healthcare spending, which becomes a very big part of the conversation. Unfortunately, though, being insurance can cause some barriers for billing and so forth, which has been kind of a large hiccup for programs that don't have the size like you mentioned before. Large size hospital programs, they could start including this, which some of the places in Florida really are, thankfully. However, there's a lot of places, a lot of rural locations that still do not have this opportunity available to them because of billing. It's a difficult place to be. I think everyone in the field recognizes this is not just a trend, but a necessary step forward. It's just the question is, how do we do it in a way that works in our current medical system, making sure patients get great care, but also is sustainable financially. And that's kind of where this program goes and reviews and really starts to dive into new ideas.
Yeah, and behavioral health, like you say, is one step. A lot of those other ones, the medical community has really struggled to get on the same page for a long time, right? You mentioned chiropractics, you mentioned yoga. It'd probably be pretty rare for most GPs to prescribe you one of those things, right? It seems like pretty often it ends up being rest or a pill, and right. That treats the symptoms type thing. And so it does take kind of a multifaceted organization, or really just a kind of a remarkable individual, because like you said, those primary care providers they're already taxed, right? They're already so busy. So that's super fascinating. That's fun. And that's interesting that's something that you're going to dive into. What else are you passionate about? What are you working on?
Let's see. Other things that I'm currently working on. Opening up some programs, because I live in Florida, and in Florida we have different populations of things, but one of our larger populations is geriatrics. And we're currently working on developing some programs, especially since COVID has become so isolating and detrimental to a large amount of populations, especially that one, considering the risk level that's been engaged with it. I'm working with some programs, partnering with them to help develop some behavioral health clinics to help restore connection, reduce isolation, which in turn helps with preventative medicine, helps reduce depression, and all those positive things that we're looking for. So that's another thing that I'm currently working on, working with a couple different programs to develop and maintain. But really, the main focus right now has been that professionals program, because I think that at this very moment, that is the largest need I can even imagine right now, especially just working in the field and talking to a bunch of doctor friends and therapist friends. and colleagues, and just seeing the toll it's been taking on people. It is immense.
Yeah, it's immense. A huge kind of pill to swallow and a lot of demand. So that's awesome. That's a great program for you guys to be focusing on. Excited to hear. Fun to hear about some of the things you're working on. You obviously, sound super intelligent, which I think, we certainly need in the field. I think in the field, there's a lot, big spectrum, top to bottom, as far as, clinicians and administrators and that kind of thing is concerned. So these sound like super awesome initiatives. Where, for any of our listeners that want to get in touch, have interest in the professionals program or any of the other things that you've talked about today, what's the best way for them to get a hold of you?
So for anyone who's interested in the professionals program at River Oaks, we have a local number. The local number is 813-547-6882. And for anyone who may be outside of Florida but interested in coming to the program, we do have a call center phone number that's open 24 hours a day with people that are staffed there 24 hours and can help make sure their insurance works for the program, or any of our other programs, because there are other multiple programs in different states. And that phone number is 888-891-9325.
Awesome. And do you have, for those that are out of state, do you have a telehealth element to that program?
So the thing about telehealth is it all goes by your licensure. So in order to practice in other states, we have to have licensure in other states, which during COVID, we were actually able to do that for quite a while with the emergency orders going on. But since the COVID emergency orders have reduced, thankfully, that ability has been sort of slipped away from us. So at this moment for our program in Florida, we can provide telehealth in Florida. There's another program in Las Vegas. We have one in Louisiana, California, Rhode Island. We have multiple different states. So depending on where any of your listeners are, if they have any of those states mentioned, absolutely, there's telehealth programs for them that they may be a great fit for.
Perfect. That's great news. Thanks for your time today, Travis. Appreciate it.
Absolutely appreciate it. Thank you for the invite.